On the Scene video coverage of AHA 2012 is supported by Pradaxa.
Well, welcome back to On the Scene at AHA 2012. I'm delighted to be joined by Dr. Bob Harrington, who's Chairman of Medicine at Stanford, and Dr. Tony DeMaria, editor of JACC, hometown both in California. We have several late-breaking clinical trials to talk about, the biggest one having a negative finding, and we'll kick off, I think, with the Physicians Health Study 2 that looked at a multivitamin. We had heard some exciting data on the cancer aspect of that, showing an apparent benefit of a daily multivitamin in preventing cancer. And today we had the cardiovascular outcomes. Tony, what was your take on the findings?
Well, it was a very long study, 16 years, all in physicians. So as you say, people who certainly are not likely to be nutritionally deprived, given the standard supplement doses, not super doses, without any cardiac benefit, probably reinforcing the axiom that if you take a lot of vitamins, you have very expensive urine.
Well, I guess it is an expensive finding of all of the supplements and things that people are taking these days.
Yeah, it's really astonishing, isn't it, that we would never advocate people take drugs at the rate that they take drugs without evidence, and yet there's many in the community who advocate you take things like multivitamins, which are incurring a huge cost to society, and yet, as Tony has nicely said, absolutely no benefit from a cardiovascular perspective.
So before we bury vitamins completely, remember all males, no females in there, just usual supplemental doses, not higher than normal doses. So I suppose there's the possibility that in the right population, nutritionally deprived, that perhaps there might be some benefit, but it sure doesn't look good.
All right. Well, two other studies looking at another supplement or non-approved drug, the fish oils, both of them looking at atrial fibrillation, one in the perioperative setting to prevent post-CABG atrial fibrillation, a very common finding, and another study, the Forward trial, looking at whether one could preserve maintenance of sinus rhythm after cardioversion or spontaneous conversion. Both of these were negative findings, moderate-sized trials, that there had been some promising smaller studies looking at fish oil to prevent AFib, but really some negative findings here.
Yeah, I mean, here you have a common problem, atrial fibrillation, either chronic atrial fibrillation or AFib that occurs in the peri-bypass period. So important clinical problems. Some suggestion, as you say, Chris, that fish oil may be able to attenuate that risk of AFib, and absolutely no effect. Yet again, another example of just because you think it sounds good, you probably ought to study it. Yeah.
Tony, have you seen use of this at all? I've seen papers, but I've never actually tried to use it in this setting. Yeah,
well, there's been evidence that the membrane stabilizing effect of fatty acids might be beneficial, and I think for atrial fibrillation, we have to say that the data are pretty definitive now. If you put these two studies with the Peter Cowie's study earlier, you've really got a substantial group of patients, randomized trial, and of course the Forward study, which happens to be in Press and JACC, was a particularly good study, I would say.
Yeah. Well, Bob, you've been tweeting here. What would be your tweet on the
I'd like to say that this was mine, but on the opera study, the tweets that are going out from other people are, it looks like the fat lady is sung, and the story for fish oils in preventing AFib is over.
Well, fair enough. Now, I guess we don't want to have all negative. So there's one very intriguing study, also I think in Press, the LoDoCo study at JACC, and this looked at colchicine, also a widely available drug used for gout, and this was for just standard secondary prevention. Do you want to describe this?
Old drug, colchicine, been around for a long time, of course, and used for multiple things. And in this particular study, LoDoCo, used kind of as a probe to test the hypothesis that an anti-inflammatory agent would stabilize a plaque post-ACS and reduce events. And it was actually a rather small study. I mean, the authors admit that it was not a definitive study, but nevertheless, a colchicine, low-dose colchicine, not high-dose colchicine, given over a period of 12 months, actually reduced composite events, MACE. So there's a number of anti-inflammatory agent studies going on. This one suggests that there may be some real value there.
Yeah, colchicine is an interesting drug. In the last couple of years at these meetings, at the ACC meetings, there's been presentations, relatively small trials, as Tony says, of colchicine in a variety of settings, including prevent pericarditis in the post-CABG period, to reduce the risk of atrial arrhythmias, et cetera. And in general, the trials have been positive. Now, whether that's the small trial selection biased or there's something to it, but I agree with you, Tony. It's an old drug, it's a cheap drug, it's pretty well tolerated when used at low doses. It's worth exploring.
Yeah, I'm not going to take vitamins or fish oils anymore. I'm going to take colchicine.
Well, fair enough. Well, so some interesting initial data, so stay tuned with us on the scene here at AHA 2012.